Okay, hi, Mike here. As promised in my previous post, I'm going to come to you with a little video series on rehabilitation while I sit here nice and comfortably. And just to reassure you to keep me on track, because I do like to go off the beaten track sometimes, ask my students. I've got a laptop right beside me with some little notes I've made to keep me on track. So, what I'm going to talk about today with regards to the rehabilitation side of things is we're going to talk about musculoskeletal rehab. So that means, what do I mean by that? So that means like your joint pain, so your bad backs, knees, shoulders, and all of that kind of stuff. So I've come across many people that suffer from joint pain and back pain for quite a while, and many times unnecessarily so. And they've been to see a lot of people and have not really got anywhere. So that's what I'm going to talk about today. I'm going to talk about how I can help you get somewhere. That doesn't mean you have to necessarily come in and see me. The reason why I'm doing these video posts is to hopefully kind of help reach out to you, whether you see me or not, whether you even meet me or ever meet me or come and see me. It doesn't really matter. I want to educate and empower because at the end of the day, bigger picture, which is what I spend my life constantly trying to look at, is the more people that people like myself reach, giving you authentic, real information, the more people that we can help, the less strain that goes on in very important services, such as the medical services and all of that stuff. So the more we kind of take accountability and ownership through empowerment, through education, then the better everywhere will be. It's as simple as that. So let's get straight into it. Let's keep me on the right track. So I've started here by saying that I've heard a lot, but a lot of the time people have come to me and they've said that they've been struggling with let's say a bad back, for example, or a bad knee or whatever. They've been struggling with it for years. They remember one particular incident when they were younger, maybe 10, 20 years ago or whatever, where their back just went, and it's never been quite right since. And they've kind of fixated on that particular point in time, and that's the time that the injury had happened. And it's not necessarily as simple as that, but we'll go into that in a bit. The story I hear a lot is they've said that they've tried painkillers and various other physiotherapists and chiropractors or whatever. That's not to knock those professions in any way, shape, or form, because obviously they're the professions that I'm very much involved with myself. So I'm not here to knock other professionals. What I'm here to say really about that is actually those other professionals, myself and other sort of sports therapists, physiotherapists, chiropractors, osteopaths, and so on and so forth. They're all part of what we call the rehab puzzle. But the main person is going to get that rehab correctly is you, and that's through the correct education. So I've heard a lot that they've had all kinds of mainly sort of painkillers and drugs and so on and so forth, and other treatments as well over the years. But what I've put together from my years of experience is a lot of those therapies have been aimed at treating the symptoms and not drilling down to the root cause or causes. Am I saying that we need to fixate on that period of time years ago when your back suddenly went and need to look for a specific cause? No, that's a fruitless endeavor. What I'm actually saying is let's look at a whole range of potential causes and things that are making it a lot worse. Let's look at how you move. Let's look at your habits. Let's break them down. Let's look at your lifestyle. Let's look at everything like that. There, we can then make an effective treatment plan. So that's how I tend to work with people. Unfortunately, it seems to get missed quite a lot. So, for example, going back to medications, they tend to paper over the cracks. They tend to treat the symptoms, such as the signals, which would be, in this instance, the pain that you're getting. That's your body's way of telling you that something's wrong. And what do? We go take some painkillers, some anti-inflammatories, and all those other bits and pieces that will help make that pain go away. Because we are creatures of habit and comfort. We don't want that pain. That's normal. There's nothing wrong with that. However, it's not going to drill down to what's actually happening. That's where we need to really get to know you and make sort of some real changes to really start to work with that. That's in a nutshell how I tend to do a lot of my therapies and rehab sessions and full treatment plans with people. So let's get into looking at some examples. Again, keep myself on track because I do like to go off the beaten track quite a lot. So, like I've said, the real problem why recovery often fails is because we're treating those symptoms, not the cause, and also because we're not looking at it correctly from a psychological perspective. And what I mean by that is we're fixating on the end goal. I have back pain. I want it to go away. Well, what about the steps you need to take in between that? What about the journey? Why don't we break that down? Why don't we, okay, let's look at our ultimate goal. That's why you're here. That's why you'd come see me, for example. But why don't we plan a roadmap follow that roadmap. Don't fixate on that end goal. And then before you know it, perhaps you're in a much better place. But at the same time, let's manage expectations. Let's also look at your habits and everything, and let's educate you. Let's empower you so that eventually you don't need me no more. You can continue taking accountability and ownership through knowledge that you've gained from me to be able to carry on that rehab journey, to keep following that roadmap, to keep that pain at bay, or at least significantly reduced, or at least significantly reduce the occurrence and likelihood of repeat injury, for example. So that's how we look at it. So let's look at a bit of a shock fact to back up and support what I'm saying. So let's take bad backs again, for example, because they are so common. 85% of cases, at least, this is what I teach to my students and students as well when they come to me for lower back pain specialist training and other things such as exercise referral and other courses I teach my students on, sorry, not treat them, teach. One of the things I teach them is 85% minimum of so-called back cases, bad back cases, are actually down to something what we call non-specific mechanical low back pain. What does that mean? Let's look at the first term there, the first two words there, non-specific. And then mechanical. So what that means is no one really knows a particular root cause. There's not necessarily what we call pathophysiology. There's not a problem there, such as a particular disease around the spine or whatever that's actually causing that. What it actually tends to be is down to improper movement patterns, poor posture, repeated poor posture. I mean, we can all sit in a poor posture every now and then. I mean, I'm sitting really relaxed now. Straight after this video, I'll go out and do some mobility drills. I promise you, I really will. All of that kind of stuff. So we get, again, it's a collection of habits. It's a collection of habits. The reason why these cases, 85% of the time, are non-specific is because of all these lifestyle issues and choices that we're making, be it consciously or subconsciously. When you look at interventions, the UK government and collectively tends to spend around about 10 billion on interventions and treatments for these back pain cases. Obviously including the other 15% that do have a specific pathological cause, but a 10 billion in total for 100% of back pain causes, and 85% of those are non-specific. Out of that 10 billion, 90% of cases don't end in any real positive resolutions. They don't actually end in any positive outcomes. That alone speaks volumes. There's clearly an issue. That's why I hear the story so much. That's why when I've rehabbed people, they've all said to me, Mike, I've been to so many different people. I've had this, seen this person, that person, tried these drugs, those drugs, and I'm no further along. And since I've worked with you, Mike, we've finally got somewhere, as if I've done something magic. I haven't. I've educated, empowered, and I've worked with that person from an evidence-based, science-backed perspective. I'm obsessive. I'm always constantly keeping up with the new evidence. And if I find that I've been doing one thing a certain way, maybe a few years ago, new evidence and research has come out to perhaps say that maybe that's not the best way, it's okay, but there's a better way, hold my hands up, we then try that and we work further. I always work off the data. So I collect as much data. I always say to my students again that your most powerful weapon is your pen and paper when you are interviewing and doing a consultation with your patient or client. Collect as much data as possible. The more data you've got, the more you can then create an informed program and roadmap, a pathway towards recovery, and also manage expectations at the same time. Like I said, there are multiple pieces of the puzzle. We need to look at the psychological. We need to look at all your lifestyle in general, your diet, and back to the psychological, your stress and everything like that. We need to look at the physical, so such as your posture, your movement patterns, how you move, how well educated is your nervous system, what kind of habits are you doing. Fantastic book to read, by the way. I massively recommend it, Atomic Habits. A very good way that you can apply to anything from business to rehab to training to getting a better diet. Fantastic roadmap again towards changing your habits. All about identifying those habits and then amending them and adapting them and adjust them towards what we call more positive habits to lead to more positive outcomes. So that's the rehab that we need to work towards. But unfortunately, a lot of the time that's not done. That's why 90% of back pain cases don't end in a positive resolution. That's tragic, especially given the money that's spent. So a couple of final points. So for example, we've got back pain. Let's keep sticking on to that, or joint pain in general. Don't just think about the back pain. If we're not going to reach any positive outcomes and years and decades have gone by, what else do you think you're going to be putting yourself at risk from? I mean, these are called comorbidities. So someone with chronic back pain for a long time, especially if it's a non-specific cause that could be so easily treated, feeling like rubbish for years and years and years. Straight away, we're getting into the realms of anxiety, depression, avoidance behaviors, repeats down into a downward cycle. The bad back is now getting worse because there's avoidance behaviors going, there's this, there's that. The back's getting weaker and weaker and less mobile. And over time, you're going into a downward spiral. Now you're moving less. Now, because you're moving less and probably eating worse as well through comfort eating, now you're probably perhaps gaining weight, going towards obesity, maybe now becoming pre-diabetic, perhaps you're giving yourself hypertension, high blood pressure, or due to perhaps hypercholesterolemia, which is where we're getting atherosclerotic arteries, which is sort of fatty deposits. So the theory is, anyways, is fatty deposits, the arteries are hardening over time, all potentially unnecessary, all because of that one incident 10, 15, 20, 30 years ago when you put your back out, perhaps doing some random movement, and that was the cause. It wasn't. Working together, we will find a way to actually go through that, educate and empower you, and look at a much better way to deal with it. We can now avoid these comorbidities. I think I popped, if I remember correctly, I popped a research down. Yeah, so a 2017 study in a Lancet found that chronic stress increases pain sensitivity. I put that one in because that goes to what I just said there with the psychological side of things. It increases pain sensitivity. So now, for example, now you're suffering from chronic stress, possibly brought on by back pain, maybe the rest of your lifestyle, maybe you hate your job at the same time, your pain sensitivity is increased tenfold. So any back pain you've got, I'm not saying you're being a wimp about it in any way, shape, or form. Believe me, I've suffered, ironically, from back pain myself, quite severe at times. I know how painful it can be. I've been through knee surgery with my right knee. Any other previous colleagues or existing colleagues who work with me will always make a joke about that because they all know I had knee surgery. The point I'm making there is your pain sensitivity goes right up tenfold. I felt it as well. When that stress was up, that anxiety was up, the slightest pain felt 10 times as much as what it perhaps should have been. So now we're dipping into pain management. But if we're not getting around to that pain management, if you're not getting the right treatment, the right support, downward spiral again, comorbidities kick in, all totally unnecessary, totally unnecessary. So let's wrap it up. If you want to do something about it, keep watching these videos I'm going to be releasing. Simple as that. If you want to take the next step, come in and see me. Come and see me in this room. It's much more comfortable now. Even got a little fake pot plant next to me. How wonderful. Come and see me in this room. We'll work together. I will listen to you. I'll do less talking, believe it or not. Those that know me, I will actually shut up and listen. I'll shut up and listen because I want to collect the data. I want to really drill down and get to know you. And once I get to know you, we can then work together. I will educate you, like I've said, and then you will move forwards with me. And we will achieve results that I don't like to overpromise. I prefer to underpromise and overdeliver. Typical cliche phrase. But I can say it confidently because I've had this 100% of the time. We will work together to achieve things that you didn't think possible. Let's do it. Come down and see me. It's totally free. And if you don't decide to continue with me, fine. I will educate you on a whole load of things and empower you because, again, I'm all about ultimately the bigger picture. The more you know, the more empowered you are, the more you can aid your own recovery. With or without me, that then helps save our system billions, absolutely billions. Because clearly, the way we currently as a society deal with things like back pain and other similar conditions, obviously, it doesn't work. And it's wasting a lot of money that I don't want to get political. I'm very apolitical, but perhaps could heat a lot of people's homes that are suffering this winter and a whole load of other things. It's all about working together. So either come see me, watch the rest of these videos, however you choose to do it. Let's work together. Let's help you go through using evidence-based, science-backed research. Let's help you get educated and make a massive change. If I can achieve that, whether you ever meet me in person or not, my life has full, amazing purpose in addition to my amazing little kiddies and my wife. In addition to that, it would give me so much more purpose, make me a very happy person to be able to make a huge difference. Okay, however I work with you, be it through these videos or in person, I look forward to working with you soon and helping you get towards where you need to be. More videos coming up. And yeah, I'll always give an honest take on everything, and I'll give as much evidence-based stuff as possible and help work with you. I will always be honest and authentic as I can, and let's yeah, let's work together. Let's get empowered.